As we age, we all experience changes in the way we feel, and we learn to cope or compensate, or we tell ourselves it's just part of the aging process. But that's not always the case. More than 8 million Americans suffer from peripheral arterial disease, or P.A.D., and don't realize it. And for those people, the heaviness that they often feel in their legs, the cramping and sore muscles that accompany a simple task like walking up a flight of stairs can be warning signs of a serious condition that could threaten their lives. We're going to speak to a prominent Jackson cardiologist who will help us understand the importance of proper diagnosis and prompt treatment of P.A.D. I'm Melanie Christopher, and this is HealthView. So what is peripheral arterial disease, and why is it important to know if you have it? Well, we're joined now by Dr. Mike McMullen, a Jackson cardiologist with Jackson Heart Clinic who diagnoses and treats people with P.A.D. Thank you so much for being with us, Dr. McMullen.
Thank you.
Why is it important to know if you have this disease?
Well, peripheral arterial disease is blockages that occur in the arteries that go to the periphery of the body, which are typically the larger arteries that go to the arms, the legs, sometimes the head, the kidneys. The disease comes in when they develop cholesterol plaques, blockages, and buildup that obstruct the blood flow in these arteries. And that can cause symptoms, but it's also very important because of its association with other types of disease, particularly heart disease and stroke.
Dr. McMullen, what is the mortality rate with people with P.A.D.?
Well, that's a very important question, Melanie, because the risk of dying from this disease is actually very high. In fact, according to the 2006 Peripheral Arterial Disease Guidelines, up to 1 in 3 of these patients will be dead in the next 5 years. Typically, though, that is related to their risk for cardiovascular disease. So 75% of these people will actually die from a heart attack, but that also includes stroke and the mortality that goes along with peripheral arterial disease. So it's very, very important to make this diagnosis so that not only can we reduce their risk of troubles from their peripheral arterial disease, but more importantly, we can reduce their risk of heart attack and stroke, and in essence, reduce their risk of death.
What are the symptoms or signs of this disease?
About 50% of patients will have atypical symptoms, which consist of pain in the legs, particularly when they walk or exert themselves, such as going up a flight of stairs. The most common symptom that we like to see is people who get pain in the muscles of their legs, such as their hips, their thighs, their calves, when they exert themselves, that goes away with rest, because that typically is indicating that they're not getting enough oxygen supply to those muscles with exertion, and that would indicate a blockage in those blood vessels. However, in order to make the diagnosis, it can be done very easily with simple tests such as measuring the blood pressure in the arm and comparing it to the blood pressure in the ankle. This is called an ankle brachial indices.
You have a special device at the Jackson Heart Clinic that you use to diagnose.
We do. We have a device called the P.A.D net, or P.A.D net. And what it is in essence is it is segmental Dopplers. So it's able to take the ankle brachial index and take it one step further by doing pressures in each of the muscle groups of the body and the legs. It also allows us to look at waveforms in these areas so that if there is disease in these blood vessels, we are more likely to pick it up than just by the simple measurement of the ankle and the arm. In fact, it increases the sensitivity and specificity of the diagnosis to about 90%.
How do you treat it?
People who have peripheral arterial disease, 60% of those will also have either blockages in their heart or in the blood vessels that go to their brain. So the treatments are very similar. Part of it would be modification of risk factors such as discontinuation of smoking and aggressive treatment of high blood pressure, diabetes in particular, lipid abnormalities. The other therapies are therapies such as antiplatelet therapy with drugs such as aspirin or Plavix. A walking program is very important for these people. They will find that the more exertion that they do, the more they're able to build up collateral blood flow to their blood vessels, and that will improve their symptoms. And then obviously there are other more invasive therapies that we can do when these mechanisms fail to treat them, such as peripheral intervention with balloons and stent placement, removal of atherosclerotic plaque that is in the blood vessels, or even surgical bypass of the lesions.
Thank you very much for being with us.
Thank you very much.
More information about P.A.D., Dr. Mike McMullen, and the Jackson Heart Clinic is available online at melaniechristopher.com. To schedule an appointment with Dr. McMullen or any of the cardiologists at Jackson Heart Clinic, call 601-982-7850. For HealthView, I'm Melanie Christopher.